We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health Systems CXOs and hosted by the Health Management Academy subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health Systems CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together, we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Welcome back to the Equity Channel. We're happy to have you here. Health systems are building infrastructure to meaningfully address health disparities, and they're evolving towards more formally integrating their health equity and quality work. We've noticed a meaningful shift in the number of health equity teams that are formally reporting through their quality leadership across the past 12 months, which serves as somewhat of a vital sign to our team at the Health Management Academy. Often we're tracking changes in executive leadership across prominent health systems. Now, Dr. Kimberly Dawn Wisdom, SVP of Community Health and Equity and Chief Wellness and Diversity Officer at Henry Ford Health, is credited nearly 20 years ago for emphasizing that quality and equity are 2 sides of the same coin. The question for today, though, is the 2-sided coin a double-edged sword? Let's talk first about the separate conversations around quality and around equity within health systems. The Institute of Medicine defines quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Now, many of us know the domains of quality like the back of our hand. It's steep, safe, timely, effective, equitable, we'll come back to that, efficient, and patient-centered. We know that quality is a loaded term in healthcare today, and I really mean that literally. It's loaded with multiple disparate bodies of work that includes quality reporting, quality improvement, compliance, patient safety, risk management, patient experience, and much more. In April of 2022, CMS released details of its national quality strategy with a more detailed action plan shared in April of 2024. Experts from the CMS Innovation Center acknowledge, and I'll quote here, that in its first decade, the Innovation Center has expanded 4 models on the basis of spending reductions and preservation of the quality of care, and has scaled models into successor models or other programs, but it has never pursued expansion of a model primarily on the basis of the model improving the quality of care. So with all of the work that has been invested in advancing quality and safety for patients, there's much that we have left to do to ensure a safe, timely, effective, equitable, efficient, patient-centered care experience for all of those that we serve. And what about equity? The Robert Wood Johnson Foundation defines health equity as giving everyone a fair and just opportunity to be as healthy as possible. Frankly, it's hard to argue with that definition, but the challenge has been in how health systems allocate resources and build a strategy to first assess the obstacles to achieving health equity and then design a clear roadmap to accomplish their goals. Resources like the American Hospital Association's Health Equity Transformation Assessment, the Joint Commission's Accreditation Standards and Voluntary Health Equity Certification Program, and NCQA's Health Equity Accreditation and Health Equity Accreditation Plus programs have been enormously helpful to system leaders looking to identify a starting point based on their organization's goals. But a journey towards equity will require a continued systematic focus on capacity building across our healthcare workforce, and a genuine recognition of the learning and the trust building that's required to make meaningful progress towards these goals. Similar to quality, there's a lot that we have left to do. So it's easy to say that there are a lot of parallels in these individual disciplines in terms of a potential path forward. But there's also a lot of parallels in what's hard today. When you think about the administrative burden associated with clinical quality, it is hugely burdensome for health systems. In a 2023 JAMA article from researchers at Johns Hopkins, a team estimated a required 108,478 person hours just to prepare and report quality data across 162 metrics for a single hospital. Many prominent health systems have upwards of 5, 10, 15 hospitals that they're reporting out on. And beyond that, they have an enormous effort associated with all of the other elements of quality and safety. Remember, it's a loaded term. We also know that equity is a nascent muscle for health systems. All of the data suggests that most folks have identified a health equity executive who has been in place for 3 years or less. I'd love a world where we don't need to have a dedicated team owning the health equity strategy for our organization and a separate team that's driving the intricacies of quality, safety, risk management, and patient experience. But that world is not one that we live in just yet. We need structured forms of accountability. So in plain language, we're trying to integrate 2 enormously pressure-filled, evolving disciplines within healthcare organizations. I love this quote from David Baker, the EVP of Healthcare Quality Evaluation and Improvement at the Joint Commission. To achieve equity, we must grapple with a large herd of unruly, poorly understood problems. For this, healthcare organizations need to shift from tackling one disparity at a time to taking a systems approach based on a clear framework. It's obvious that it's hard, but I hope that we can use this podcast as a brain trust for actionable solutions instead of just a channel for complaints. You can email our team if you want to complain. A couple of examples of health systems I'll spotlight that are doing some compelling work. First, Novant Health, headquartered in Winston-Salem, North Carolina, has worked tirelessly over many years to integrate a focus on equity across the breadth and depth of their organization. I love their use of dedicated transcultural health managers to help their workforce navigate the ever-evolving needs of their patient populations and create an environment of true psychological safety for clinicians across the system. Their system was one of the first to successfully complete NCQA's Health Equity Accreditation Plus program back in 2022. New York City Health and Hospitals has also been an industry leader in this work. We've loved learning from their board and how they fully leverage diversity in all of its forms to ensure that their work as the largest municipal healthcare system in the nation meets the needs of all of the patients that they serve. Board Chair Dr. Jose Pagan has shared the importance of building trust across the board to ensure both transparency and accountability in how they drive change. We aren't going to figure this out overnight in healthcare, and no one has a crystal ball, but this is what our team sees next. First, board leadership is critical in this moment. If it's structured well, it provides the perfect tool for integrating community needs, leadership accountability, and psychological safety. Listen back to the last episode in the Health Equity channel for our thoughts on what makes for an effective board. As we continue to navigate what many have called a poly-crisis era, the health systems that perform well will be the health systems that invest substantial time, resources, and strategy into change readiness. We know how taxed the healthcare workforce has been over the past 4 years, and the challenges to our health and our well-being as a country show no signs of easing into the foreseeable future. You have to prepare your workforce to execute and prepare your leaders to balance agility with accountability. So, is the two-sided coin of equity and quality a double-edged sword? In my view, the answer is probably yes. But we don't have the luxury of shying away from unpacking the complexities in doing this well, and health system executives need to be well equipped to design a path forward. So let me leave you with a few resources to check out. First, the American Medical Association's Center for Health Equity has done some phenomenal work on integrating equity and quality in partnership with the Brigham and Women's Hospital and the Joint Commission. Check out their free resources through the Advancing Equity Through Quality and Safety Peer Network series. The Joint Commission also has some wonderful supports available through their Healthcare Equity Accreditation Resource Center, which you can access through the website. And finally, the CMS Quality in Motion resource is worth a careful read. We'll include that in the show notes. If you have any trouble finding any of these resources, email us and our team can point you in the right direction. We're also regularly convening health equity and quality executives, and we'd love to hear from subject matter experts who have perspectives to share across the Health Management Academy's network of thinkers and doers. Check out the show notes for more information on how to get plugged in here. Who do you want to hear from on this topic? Reach out to Health Equity Alliance at hmacademy.com with suggestions, ideas, pushback. We'd love to hear it all. Thanks for listening, and we'll see you next time. Thank you for joining me on the Health Systems CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health Systems CXO Podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, Consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.